Kenora-Rainy River.
The question is to the Minister of Health and Long-Term Care. Substance abuse in First Nations is no secret. Entire communities are battling addiction and a sense of hopelessness is prevailing. 2 months ago, the government delisted OxyContin without a clear addictions and treatment strategy in place that would help communities manage the impact of this decision. First Nations have been asking for an addiction strategy for years. As recent as 2 months ago, when you delisted OxyContin, Minister, I asked what the plan was. Minister, we're still waiting. What is the plan?
Speaker, thank you to the member opposite for this very important question. And I know that all of us are firmly committed to being there for people who choose this opportunity to address their addiction, Speaker. The delisting of OxyContin and the replacement of that with OxyNeo, we know is is changing the landscape of addiction in many of our communities, most especially in First Nations community. I want the member opposite to know, and other members of this House to know, that I have convened a remarkable panel of people, Speaker, many of them from the First Nations communities in the North. We are taking the steps, the recommendations that they are making to us, including, for example, Speaker, sending an additional doctor to Menayawin and Sioux Lookout to support the methadone treatment program. The Ontario Telemedicine Network, Speaker, is stepping up their ability to support people as they go through this addiction.
Supplementary.
Months ago, the community of Cat Lake declared a state of emergency, looking for help dealing with the crisis in their community and across the North. This week, children in Cat Lake wrote their family members who are in the grips of addiction, saying, quote, "We don't know what to do to help you stop doing drugs." Minister and experts know that treatment and services, they know which treatment and services can help. If only we had the political will to provide these programs. How much longer will these communities be forced to wait?
Good question.
Speaker, we are taking significant action on this very important issue. Very important, Speaker, that Health Canada step up and play their part as well. One of the additional steps we have taken, Speaker, is to fast track the approval for Suboxone. Suboxone is a medication for people who have tried methadone unsuccessfully. It's another tool in addiction treatment, Speaker. So I'm very pleased to say that the Exceptional Access Program has fast-tracked Suboxone, so now people are getting an answer within 5 business days as to whether or not they are eligible for this particular drug. Speaker, there are many initiatives underway.
Answer.
I would ask the member opposite if she would be willing to have a meeting so I can review with her the initiatives happening in this
Thank you.
Wonderful.